What's up, guys? It's Chris here again. So, what's going on TikTok? So, we're going to talk together about this TikTok video about a nurse who presumably is openly mocking her patients, making jokes and calling out, doing some annoying behaviors, behaviors that were annoying to the public. So, it is not just a private vent, it's a shared, it's about the shared public views about this, and patients begin to feel ridiculed. So videos like this are sparking a lot of outrage. Such behaviors undermine trust in care. So it's something that we should really talk about, like, so actually employers have responded to the real cause, and when this kind of video go viral, the hospital is under attack, the hospital is condemned, and the behavior, there's really has to be some accountability for the behavior. So some legal actions are usually taken. So let's look at the implication of such behavior. So professionalism. So you have a risk of losing your profession, right? So if you're a nurse and you practice such a behavior, and you see it's becoming rampant now with social media, you are expected to keep your patient's dignity. So mocking a patient across causes some moral and ethical issues, and legal risks may come up. So depending on what you show, there could be some violation of privacy or confidentiality. And there's also trust damage. So videos like this can reduce the public's trust in the health worker and even in the hospital if nothing is done, and also reduces reputation. So for the institution, there is public image damage. For the nurse, there's a risk of disciplinary actions, which was actually what was done. The nurse was actually she actually lose her job. So actually, there are really some defense to this. So some people see it as venting or humor, a way for the nurse or the health worker to, relieve some pressure or to blow off that steam, after the stressful day and all that. And some people also argue that these are just mere jokes and not meant to harm. But again, we are talking about being professional. So, what do we learn from this as nurses? With this era of social media, with our cameras on, our videos, ready to make videos and everything, what do we have to learn as workers in the front line? First thing, we have to maintain professionalism, even on social media, we have to be professional. Social media venting about work is risky. You might put your patients at risk at that vulnerable stage where it compromises trust. So another thing is institutions must be clear about policy on what staff can share. This is also an issue, because if you don't have a policy of what staff can put out there, it may actually lead to such reactions, because we don't know the consequences. And as a nurse, you have to protect your patient's dignity. That is why you are called to serve. You are called to serve your patients and maintain their dignity. So the viewers and public should not see our caring act as a source of fun. These videos may seem harmless, but they have a deeper meaning that goes beyond the beyond what you pledge to do as a nurse. We have to understand that professionalism and empathy must guide every action in healthcare, whether online or offline. So mocking a patient is not only about harm, but it causes emotional damage, right? And can also lead to legal consequences. So we as health workers need to pause, reflect, and uphold dignity in every interaction we make. So if this message matters to you, like this video, share, and raise awareness. Thank you.